Ready?
Okay.
Okay, doctor, if you would say your name for me and spell it.
Thank you. Bye-bye.
Dr. Gus Gonzalez. Last name is spelled Gonzalez. I'm the first
Here.
medical director of the Memorial Hospital Pembroke Urgent Care Center.
Okay, you're going to look at me at the camera. All right, so tell me what the Urgent Care Center does first. What happens here?
Well, the Memorial Hospital Urgent Care Center has been in the community for over 35 years. It's been serving the community of the South Broward Hospital District in multiple facets over the years. We presently are able to see adults, pediatric, and a variety of moderate to minor acuity conditions.
Who would come here versus an emergency room?
Urgent care centers primarily differ from emergency rooms in that urgent care centers do not receive ambulances. Therefore, you don't have the long wait times that you may traditionally see in an emergency room. Also, urgent care centers, because primarily the acuity, that means the illnesses are of lower grade, you are able to come in and come out much quicker. And they're tailored and staffed to do that. The testing is done on site. The results are provided on site. Any hospitalizations that are necessary from the urgent care center can still be provided through all of the memorial assets that we have in the district.
But there is some wait time. That's an issue.
The wait time is something that is monitored by our clinical managers, which is a nurse that's on staff and managing the flow of patients. The wait time is significantly different in an urgent care center as opposed to an emergency room. I would say it's far less. For example, our average wait time is perhaps anywhere from 5 minutes to 30 minutes. And of course it depends on what time of the day and how many patients are coming in and out, because it is a first come first serve, as well as if we have someone who comes in that's sicker, that patient obviously is going to be attended to and may require a little longer care by the staff, but much shorter. Our throughput time, which means the time that the patient enters the facility and then exits to their car and goes home, is less than 2 hours, as opposed to the average emergency room, which may have a wait time door to door. That means you come in, you go back to your car, of 4 to 8 hours across the United States.
Is it constantly busy in here, or there are times or days that are worse than others? Or
we're open 24 hours. It's absolutely unpredictable. We do have peak times, and it depends on whether kids are out of school, whether children are getting out of school, they're on vacation, it's summer, the winter illnesses, so there are variables.
What do you want people to know about the Urgent Care Center?
Urgent care centers are rapidly becoming the go-to place for families, busy families, moms that need to get dinner started and the child is getting out of school at 2 or 3 o'clock and has a fever, has an illness, has abdominal pain, but still needs to make it home by 5 and start dinner, as well as people who have an important illness such as chest pain, shortness of breath, their asthma is flaring up, and you're basically in and out. It can provide all the same services that an emergency room can, and what cannot be provided on site. Since we are part of the Memorial Healthcare System, we have access to it all, including, as I said, admissions to the hospitals of one of our 5 hospitals.
Did you mention how many patients come through here each year?
The urgent care sees 51 to 52,000 patients per year, an average of 140 to 160 patients per day. We're staffed with 4 physicians for the majority of the day. As a matter of fact, there's only 1 physician between the hours of 4 and 7 a.m. So the rest of the day we have more than 1 physician seeing patients. We have a designated pediatric area. We have designated adult areas. We have 28 beds. It's a nearly 10,000 square foot facility, and it's very accommodating, and it provides private areas for patients.
The key is to get people in and out. Is that it?
The key, and that is the sole purpose, is for patients to have a facility that can provide a non-appointment based in and out rapid care access. And that access can expand from minor acuity to an admission if needed, with IV antibiotics, oral medications, testing on site, and multi-specialty backup that we have.
Dr. Rigoberto Peña, please dial extension 837499. Dr. Rigoberto Peña, please dial extension 837499.
Only once. That's pretty good. It's only come on once. Anything else that we didn't touch on that you want to talk about?
No, I don't see anything in the computer either. It's for humanity.
Cheat sheet.
It's okay.
We want to talk about the concierge service.
Oh, this is now the part we're doing for the website, right?
This is now the part.
I need to shift gears then, wait.
You don't have to. I can, when I go into editing, I'll cut and paste and move things.
But if we could talk about all the benefits now, and that way we just have them. So, like,
We can just do that one little segment that I want for the urgent care separately, because, like I said, it's very brief, very.
yes.
And I can talk about anything else. Let me.
We're ready.
So we'll say something about family-centered care. We'll say something about hospital affiliations.
I think that's it.
Sometimes you get two,
Too much.
and then you remember this will be around for a while, and as things change, then
All right, let's cover the family-centered care. Talk about that.
the urgent care center is a family-centered care facility, as is the Memorial Healthcare System, meaning that we integrate the family into the care of the patient, and we're very attentive to the needs of the patient once, not only in the facility, but once they go home, and the family can then participate in the care of the patient by being informed as to what the problem is, what the follow-up is. Our follow-up system includes all of the assets, meaning all of the subspecialties of the Memorial Healthcare System. So we integrate that and the family's needs and ability to transport the patients to those areas.
Okay.
So we're very much in touch with the community physicians and the subspecialty physicians that the patients will be seeing.
Also, the hospital affiliation.
The hospital affiliation of Memorial Healthcare is integral to the urgent care center.
You can start over.
The subspecialty and hospital affiliation of Memorial Healthcare is extremely important to the urgent care center because it offers the patient all of the subspecialty, all of the other services provided by all of the Memorial Healthcare system, which is extensive, and all of the over 15 to 1,600 physicians that we have on staff. We can access that from the urgent care centers via referrals and provide the patient with that follow-up in multiple specialties that we, as a matter of fact, only the Memorial Healthcare System has in the South Broward area.
Do you find that a lot of people don't realize this is here?
Yes, the urgent care center, although present for over 35 years in the area, is in an area which is 801 South Douglas Road in Pembroke Pines, and it's kind of tucked back in an area behind some trees. It has a very large campus and an extensive parking lot, very accessible off the main highway, but very few people know about it, and it's a very well kept secret, as many patients as we see. And many people have come to find out about it, not so much through the media, but just by word of mouth. Either they brought their child, who then brought in grandma, who then brought in grandpa, who brought in a cousin, and this is how we've grown over the years.
And you did say it's 24/7.
And it's open 24/7.
Okay. Anything else that we didn't hit?
There's always more you can add, but
Those are the.
I think for the web page, that probably hits.
Now you want to do the other segment.
Can you think of anything else?
We want. I mean, I know you talked about some of the things you guys treat, but I think that's the main focus. If we could just one more time go over.
Yeah. What do you treat here versus what would be treated at an emergency room?
The urgent care center, aside from having the multi-specialty backup and the ability to admit a patient with a comprehensive, complicated medical problem, we're able to treat minor illnesses, sore throat, pneumonias, asthma, abdominal pain, urinary tract infections, gynecologic conditions, some pregnancy-related problems, and as well as burns, suturing, broken bones, tetanus, vaccines, antibiotics that are needed either through the vein or orally, So we can provide a variety of things, and whatever cannot be provided within the facility can be provided through our other hospitals.
Do things pick up in the summer with the kids out of school?
Actually, our busiest times at the urgent care center is the winter, because that's the influenza season, croup, asthma flares up. The summer, though, does have its own set of problems, but it does tend to decrease somewhat in volume.
Okay. All right, let's talk about what you wanted to talk about.
Okay. So let's switch gears. I just want to run through. Is there anything else?
That's fine. Amber's trying to keep our site a little newsier, and I think you got it with the seasonal, so you can do what you need to do now.
If you want to, we can also, we have a community outreach program. When I started there 16 years ago, what I did is I started doing some grassroots marketing. So I would go out to civic groups, Chamber of Commerce. If you want to include that, we do provide speakers, mostly me, some of the other doctors too, and in English provide a topic. We do round tables, for example, at daycare centers. We'll talk to the mom and dad.
Know in general,
but you don't want to put that in there?
Writing.
Yeah,
you don't have to do it in
text.
video. We'll have it in text.
So we have a speaker program,
and I'll
basically.
let them know, because that's what this website's going to be for too, so the media can come and see, wow, we have this, we have that.
Well, I do
Who's
what's going
available as
around
an
on Channel 10. Are
expert?
you Channel 10? No.
No, but I know
private.
Kathy Corso.
I do what's going around.
Yeah, with Marlon.
And then we also do 6 and 51 sometimes in Spanish.
Right.
I do that.
And that's what we are. That's what we're kind of. That's going to be our audience for what we're doing, is so that they know what we have, and they can just quickly go on there and say, oh, you know, he looks like a good guy to interview, and then they can see you speak, and then we can use that, and then they can see what you offer. But it'll be great because we're going to have a section on there offering experts, so they can quickly have a downloadable about who can speak, and we can put that on there, definitely.
Do you want to add anything about insurances? That everything is, or you don't want to go there?
What's kind of in specific?
Everything.
about the
Everything in
insurance?
ER takes, it's EMTALA regulated. That means that we see
Yeah,
everybody.
read it on.
Okay.
That's like you said, that's something that changes all the time.
Okay, so that, the speaker program, okay.
You wrote one?
Did you talk about what you wanted to do?
We're going to do that right now.
No, we're going to do that now.
Yeah.
And that's more tailored to the individual. Now I'm talking to the patient that's bedded, meaning brought to an area to see the doctor. A little squint over to the side gets me.
Yep.
Welcome to the Memorial Hospital Urgent Care Center. We're happy we chose this. You chose this. Let me start over. Welcome to the Memorial Hospital Pembroke Urgent Care Center. We're happy that you chose us as a site of care for your illness today. My name is Dr. Gonzalez. I'm the medical director, and I'd like to explain what your visit would be like today here with us. Once that you're greeted at the entrance and you sign in, you'll shortly be brought to triage, which will assess your condition. And depending on your acuity level, you may see some patients that are brought back before others. Acuity meaning if you have a sore throat versus someone else who may be having chest pain or shortness of breath or a very sick child. In that event, those people may be brought ahead of you. Please don't think that we're taking them before you for any other reason other than their condition. But you'll be brought back promptly. Our wait times are minimal, but it's first come, first serve as well. Once you're brought back to our treatment area, you'll be placed in an area where a physician and a nurse will greet you. The physician will shortly be with you. Our physicians see 3 to 4 patients at a time, as well as our nurses. Those individuals that are in those areas vary. You may be there because of a sore throat. Our physicians are seeing also patients that have abdominal pain or some more serious conditions such as chest pain or asthma that may require more of their time. If you see that there's a minor delay, please understand that it may be because of the illness of the other patients that are present at the time. Once you're seen, the physician examines you. All of our testing is done on site, x-ray, laboratory. The turnaround time, that means the time it takes for the test to come back, is very short, very brief. It will come back. It is dependent on volume though, but it will come back. Once we have those...
Dr. Rigoberto Peña, please dial extension 838433.
You will come back, or
Yeah, the script come back.
Right there.
As soon as the tests are available for the physician will keep you posted as the test results return. He may tell you about some of the tests that have come back that are important. He may come back all at one time and then review all of them with you, describe the diagnosis, the treatment plan. Then he will sit, he will chart, he will prescribe medications. All of our records are electronic health records. They're entered. Your discharge plan will be entered into the computer. As I said, we are center. No, that was the previous conversation. Once the physician has finished assessing your laboratory values, your x-rays, and evaluating them with you, he will inform you of your diagnosis and results. He will then complete the chart, give it to the nurse, discuss your care with her, your discharge summary, care plan, and follow-up. Remember that our nurses are also sometimes busy with other patients, as I said, that may have a more serious condition than yours. They are preparing your paperwork. As soon as that's completed, this will be brought to you, discussed, and all of your appointments and follow-ups and prescriptions will be presented to you and explained to you. Any minor delays, please keep in mind, maybe because of someone else's illness that is somewhat greater than yours at the time that consumes their time. But they will, repeating myself. You want me to start over at diagnosis results?
Sure.
Okay. Once your laboratory results are completed, the physicians will sit down with you, go over your results, x-ray, laboratory, inform you of your diagnosis, your care plan. You can discuss with him your follow-up. At that point, the diagnosis will be conveyed to the nurse, which will prepare your discharge, your follow-up information, which will then be brought to you in a computerized typed form. You'll also have some information about your diagnosis that will explain what you have, as well as your follow-up information, contacts, and follow-up numbers. If there's any delay, please understand that our nurses and doctors are also seeing other patients at the same time that may have a problem that is more urgent, but they will promptly be with everybody, and the delay should be minimal. Once the diagnosis is then provided to you, you will be taken to registration for the end of your visit with us, and hopefully your return with any future family members that you may have that we would be delighted to see.
Once you do that part again, just that end part.
Which one?
Just the last part. You'll be brought back to your family, that kind of thing. Reunited with your family.
Once the diagnosis is provided to you and the nurse completes her discharge summary and evaluation and discusses your results, provides you with contact numbers and telephone numbers for your follow-up, you'll be provided the information which will explain your diagnosis, and your visit will be complete. We will be happy to see you in the future with any further problems that you may have or with your family members. And please keep us in mind during your
You can do that part again. Please keep us in mind. That's fine.
Please keep us in mind for any future conditions that may arise, urgencies, whether minor, or questions that you may have regarding your health. You can also contact us.
Please dial 838715. Dr. Anna Abraham, 838715.
We're going to be able to keep that to a minute?
No, but I'll figure it out.
Yeah.
Please keep us in mind. Let's do that part.
Please keep us in mind for your future needs, and remember that we're able to see children and adults at your convenience. How do we phrase this? Please keep us in mind. I don't want to talk down to them. I want to talk at their level. So I don't want to use. Please keep us in mind for your future.
We hope you'll keep us in mind,
The next time there's urgent.
I don't want to say future illnesses. It sounds dooming.
We hope we can be there for your future healthcare.
We hope that you keep us in mind for future visits. How about that?
For your future healthcare needs, because
There you go.
Anything. Yeah.
Thank you for coming today, and we hope that you keep us in mind for your future healthcare needs.
Perfect.
Do we want to look at this and see what I did and see if you? Okay, let's go. Well, we got some things.
Whenever you're ready,
Your jacket's puffed up on one side. Should I put in the
You know what? I used to wear jackets. I wear scrubs for a living. Bienvenidos al Urgent Care Center de Memorial Hospital Pembroke. Espero que su estadía aquí con nosotros sea buena. Les quiero explicar momentáneamente. Wait, let me start over because I didn't say who I was. Bienvenidos al Urgent Care Center de Memorial Hospital Pembroke. Yo soy el Dr. González. Soy el director médico de este departamento. Este departamento es uno de los 5 hospitales de Memorial Hospital Healthcare System. O sea que tenemos todas las subespecialidades y todos los hospitales a su disposición de acuerdo con sus necesidades médicas. Quiero explicarles brevemente la estadía suya aquí en el Urgent Care Center. Una vez que la enfermera en el centro de espera los vea, de acuerdo con su gravedad de enfermedad, los va entrando a las camas. En ese momento entonces conocerán su enfermera y su médico, que brevemente entonces empiezan a verlos a ustedes y ordenar las pruebas necesarias, sean laboratorios o radiografías que se hacen aquí dentro del departamento. Cualquier demora que ustedes perciban es porque tenemos varios niveles de gravedad, sean dolores de pecho, dolores de garganta, neumonías o asma. Acuérdense que en cualquier momento se les puede contestar cualquier pregunta que ustedes tengan sobre cualquier demora en su cuidado médico.
go back just a little because you stumbled over it a little bit.
Right.
Es el departamento de urgencia, ¿no?
Did I what?
You were saying en este departamento. You should, if
En el
En el
departamento.
departamento
Yeah.
de urgencia de Memorial Healthcare.
Yeah, but how far back did I say that?
I think I think that and we can clip it, but I think that it should stretch a little bit there in between. So you can, you should just introduce yourself, say, you know, what you were saying about, but make sure you say, you just say Memorial Healthcare System, because la sistema de hospitales de Memorial Healthcare System is not the way we
Right, so let's
brand
just start over.
Yeah.
I have no idea when I said what.
it. Well, I
I'm
was just
rattling.
listening, and I'm like,
Yeah.
okay, like, how can we piece this back
Right,
together?
right,
Keep it short.
Right. Bienvenidos al sistema de Memorial Healthcare System y al Urgent Care Center de Memorial Hospital Pembroke. Dentro de poco,
It's okay. It's hard to switch. You switch 3 times.
well, I think in English and speak in Spanish.
Yeah, that's how I do it.
So I'm translating, because I grew up here and I was born here. Bienvenidos al Memorial Healthcare System y al Urgent Care Center. Dentro de poco tiempo los registrarán, conocerán su enfermera, su médico, y se ordenarán las pruebas necesarias de acuerdo con su nivel de gravedad. Acuérdense que en este momento nosotros tenemos muchas camas y los pacientes tienen distintos problemas, igual dolores de pecho, asma, que otros problemas que requieran el tiempo de su médico o enfermera. De todas formas, se les mantendrá informados sobre cualquier demora que haya en su cuidado médico. Dentro de poco, en cuanto a los análisis y laboratorios y radiografías que se han hecho dentro de la unidad estén dispuestos y disponibles, su médico se sentará a explicárselos y desarrollarán un diagnóstico y un plan para y se desarrollará un plan para que usted pueda seguir su cuidado médico con su médico privado o el especialista, que se le dará toda la información. La enfermera se sentará con usted y le va a proveer toda esa información dentro de poco. Cualquier demora que ustedes vean que hay es porque esos otros pacientes que posiblemente estén un poco más graves requieran el tiempo de su enfermera o su médico. Cualquier pregunta que usted tenga, por favor diríjasela a su enfermera o su médico para que le expliquen el...
Okay.
It's good because it's
Whatever
long
question.
enough that you could, right?
Okay.
Cualquier pregunta que tengan.
Cualquier pregunta que ustedes tengan sobre su cuidado o cualquier demora que ustedes perciban, exprésensela a su enfermera o su médico. Dentro de poco le darán sus papeles del alta y todo será explicado para usted, para que usted entienda los teléfonos que tiene que llamar y los especialistas que necesita ver. Estamos, okay, we're going to wrap it up. No, I just want to tell them that we're happy that they came, they chose us.
Estamos contentos. Estamos
No, that's not the right one.
agradecidos.
Estamos agradecidos que ustedes hayan escogido al Memorial Hospital Urgent Care Center para su cuidado médico hoy y que nos consideren en futuros días para cualquier problema que se le presenten a usted, o a sus familiares. Y acuérdense que vemos a igual adultos que a niños.
You want to take? I hate to make it over, but
No,
it's
go
more
ahead.
like
Let's do it
trying
right.
The adultos and niños, put it before, because you finished and you're like, and pediatrics and adults. You know what I'm saying?
So you want to do it when?
So right when you're saying, you know, we hope we can take care of your family, you know, being adults or children,
Right.
and da da da, and then finish.
Estamos agradecidos que nos hayan escogido hoy para su cuidado médico. Acuérdense que podemos proveer cuidado médico para usted, los adultos o los niños, en el futuro.
Yeah, it's fine. We just still had it backwards. That's okay. But it's
Well-
still fine. It's because this time it sounded finished.
Yeah. And like
Yeah, I'm
the
trying to
other
wrap
one is
it
like
up.
You wrapped up, and then you were like, oh, I forgot something.
Yeah, the other
So
one-
you
I
got-
did.
Wait, now for your release, I know I hate to torture you.
Aren't you supposed to have dummy cards?
Yeah,
We're here.
see, I didn't know we were doing this
Yeah.
part, or I really would have had.
Now, you know what it
we
is?
would
I
have
got
had
out of
a
work.
prompter for
I
you
got out
with
of
all
work at
of it
4
set
a.m.
up.
I went home, went to sleep. I was going to wake up and put something together, but did I do that at the beginning for the Spanish part?
I don't
Yeah.
remember.
Yeah.
You did? Okay.
Yes.
Well, he
You
did
did
it
the second
the-
round.
He had, we
Yeah.
can they
Yeah,
can
yeah.
be edited because you did it the first
Yeah.
time, then you didn't do it the second time, but the first one was, I think, good.
The same way we do it.
But it was in English. Or did I do it in
No, you
Spanish?
did it in
Yeah.
Spanish,
Spanish
but
the
then when you
first
did the
one.
second take, you didn't. But the
Right.
first one was.
Oh, the difference between urgent care and emergency
Mhm.
in Spanish.
Yeah.
Just
But
introduce
don't do it
yourself
too long.
first.
Yeah, and just a quick,
Because you,
you
want
know.
it to be enough that they want to pick you as strong Spanish
I
for
got
Speed
you.
the
dating.
interview.
I got you. Bienvenidos al Memorial Hospital Urgent Care Center. Les quiero explicar la diferencia entre un Urgent Care Center y una sala de emergencia. Un Urgent Care Center tradicionalmente es un centro que ayuda a las enfermedades y a los pacientes. Oh. We'll leave the first part the way it was.
Just say, mi nombre es Dr. Da.
Right.
Les quiero explicar qué es la diferencia entre el urgent care y la.
Mi nombre es el Dr. Gustavo González, soy el director médico del Memorial Hospital Pembroke Urgent Care Center. Les quiero explicar la diferencia entre un Urgent Care Center y una sala de emergencia. Una sala de emergencia tradicionalmente incluye ambulancias, largas esperas y ciertas pruebas que se hacen que son especializadas dentro de un hospital, incluyendo el ingreso al hospital. El Urgent Care Center no tiene ambulancias, las esperas son mucho menos y en específicamente el Memorial Hospital Urgent Care Center tiene todas las capacidades de una sala de emergencia y las que no se incluyen dentro del Urgent Care Center, como es afiliada a un centro hospitalario con 5 hospitales, tiene todas esas mismas pruebas disponibles a través del sistema de Memorial Hospital Healthcare System.
That's perfect.
Just the ending part.
Yeah.
Yeah. Let me repeat that. Tiene todas las especialidades del Memorial Healthcare System.
That was perfect.
Boom.
We're good.
Even perfect for a